is that we have, in each week, we have 4 segments that we go through that comprises of that weekly workout. And that's strength, where we really focus on strengthening the legs and the core. We focus on our posture, that way our balance center of mass is placed where it's supposed to be. We also work on flexibility so that muscles are able to function through their required range of motion, the way they were designed to function. And then, of course, balance, where we're concentrating on the mechanoreceptors and the proprioceptors. Mechanoreceptors at the bottom of our feet. Proprioceptors, those receptors at the end of nerve endings in our epidermis, in our skin, in our bodies. Again, that goes with phantom pain. If you've ever known anyone that's had an amputation and then they still feel that that pain is there in their arm, that's the brain trying to connect to those proprioceptors. It helps us orient our bodies in the world. So today, we're actually going to go through week 1. And the benefit of coming to class is we can make modifications. In other words, if I see someone struggling, I try not to point that out. None of my instructors, they're all told not to point that out, but make a generalized suggestion. We don't want to make anyone embarrassed or make anyone feel bad. Or I can offer a progression. If something is really easy, then I can provide a variable that will make the exercise a bit harder. A variable, so if we're standing in our split stance, what I like to call also the balanced position of confidence, and I look around the room and a lot of people, this is very easy. What I will do is provide a variable. Close your eyes. Or move your arms. Or shift your weight. So there's a number of different variables that we can use to make an exercise harder. And we can use a combination of those as well. I can close my eyes and shift my weight. And so in class, these are things that I can suggest while I get that feedback, that visual feedback. So moving forward today, we're going to go through week 1, which week 1 is kind of a foundation. Balance University, this 10-week course, is fantastic for someone who is at home a lot, who doesn't have access to classes. Once you finish this 10-week program, you go into the graduates program, which is then a weekly, it's a continuation of Balance University. It's a weekly class just like this where you meet once a week. You become a Balance University graduate and you move into the graduates program. You get a nice sticker and a shirt and move on in. So again, let's start with our assessments like we did yesterday. We will do all of them today. So what I'd like to have you do is we'll stand up and you can use the table. You could use your chair if you would like. But we're certainly going to stand up. And our first, I have a pen, if you'd like a pen. I don't have a pencil, I'm sorry.
Maybe I don't need to write that.
Oh, yes, sir. You got it all right there in your book. So we'll stand up and you can use the table or your chair, and I can, if you'd like my chair, I can give you another chair. That way you don't have to go back and forth. Would you like to use them? Yes, sir. All right. We're going to start with our feet hip width apart. Okay, we're going to start with our feet hip width apart. Bend your knees. Pull your core in tight. All right, now I want you, you're going to stand. Keep your hands close to the chair. On my mark, you'll close your eyes. Okay, and you're going to stand that way for 15 seconds. Now, I want everyone to be safe. So if you feel uncomfortable or you do not feel confident, keep your eyes open. All right? So this is part of that vestibular system we talked about yesterday. Okay, we're instrument flying. We're flying by our instruments now. Okay, so hands hovering on the chair, eyes closed. Time begins now. Good. And if you feel like a tree in the wind, go ahead and use your hands on the chair. Good. And 3, 2, 1, and time. That's well done. Now we're going to take our feet and move them side by side. We'll move our feet close together, side by side, same thing. All right, hands on the chair. We're going to do that. Yes, sir. We're going to move our feet close together. That's it, as close as you can get them. Hands on the chair. Core tight, shoulders back. Eyes closed. Time begins now, 15 seconds. If you feel comfortable and confident, you can raise your hands an inch or two above the chair. If you feel unsteady at all, go ahead and open your eyes, grab the chair. And 3, 2, 1, and time. Very good. Now, I would like everyone to put the chair on the left side. All right, so I just want you to simply turn so that the left leg is closest to the chair. Okay? And what we're going to do here is we're going to try, ma'am?
No.
Oh, what we're going to do is stand on our left leg. We're going to stand on one foot. Now, there is a process to this. There is a way to do this, okay? And what we're going to do is we're going to shift our weight to our left foot. Let me demonstrate, and then we'll all do it together. You're going to lift your right foot underneath you, not behind you, not in front of you. It's just going to come about an inch off the ground right underneath you. All right, you have your hand on the chair. From this position, you should get a pretty good indication if you can let go or not, right? If you don't feel comfortable or confident, just hold on throughout the duration of the 15 seconds. If you do feel confident, then you can go ahead and let your hand hover. It also is okay to use 1 or 2 fingers, okay? So here we go. Staying close to our chair, we're going to shift our weight to our left foot. We're going to raise that right foot about an inch or so into the air. That's it. Using that chair, time begins now. Now, once time is started, if you feel comfortable and confident, you can lift that hand. That's it. Very good. Eyes open. Good. And 3, 2, 1, and time. So now, the second part, we're going to do this same thing with our eyes closed. All right? So listen carefully to the verbal cues. Because the way we're going to do this, right, there's going to be a step to this. Step 1, same as before, shifting your weight. Step 2 is lifting my heel in the air. All right, now my toes are still on the ground. My heel is in the air. My knee is slightly bent. My left knee is slightly bent. I'm going to close my eyes in this position. This is step 1. This is going to give me a pretty good indication of whether I am capable right now to be able to lift that right foot all the way up in the air. If this is really challenging, still having my toes on the ground, I'm going to keep them there. All right? If you feel comfortable and confident, you feel like you have control, you can go ahead and raise that foot up into the air. If you can't get the foot in the air now with the eyes closed, that's okay. The whole point of this whole process is by week 10, you're able to do that. So if you can't do it today, that's okay. All right? All together. We're going to shift our weight to our left foot. Right heel is in the air. Bend your knee. And close your eyes. Take a note. How do you feel? Are you swaying a lot? Is it really hard? All right. Time begins now. If you feel comfortable and confident, you can raise that foot up in the air. If not, keep it right there. This is efficient. This is where we want to be. And 3, 2, 1, and time. Well done. Eyes open, foot down. Good news, we're going to do the same thing on the other side. So let's all turn and face this way. All right. So, same thing. We're going to shift our weight. First time is with our eyes open, okay? First time we do this, eyes open. Now we're balancing on our right foot. So we have the chair on the right side. We're going to shift our weight to our right foot. We're holding on. And we're going to lift that left foot right underneath us. Right? Time begins now. Right underneath you. Very good. Use that chair if you need to. Find a spot in front of you and focus on it. It's tough, yeah. 3, 2, 1, and time. Good. Same thing. This time we're going to close our eyes. All right? Do two-step process. We're going to shift our weight to our right foot. Hand on the chair. Left heel in the air. Bend your knee. Eyes closed. Now your toes should be on the ground. Take a note. Time begins now. If you feel comfortable and confident, you can take that hand off the chair. But be safe. Be safe. And 3, 2, 1, and time. Well done. Eyes open. Good, good. We do that assessment, those exercises right there before every class. And that is also what you're indicating here. Day 1 with the date. You stand with your eyes closed, feet apart. If you did not touch your chair the entire time, you would record a 0 in this box. And then if you touched it 1, 2, 3, 4, or 5, what this does is this gives us tangible data, so at the end of the class, at the end of the 10-week program, we can see our results, right? There's nothing to hide here. If we're not improving, you need to get a hold of me, and we need to find out why, right? Falling is not a natural part of aging, okay? So, let's go ahead and let's move into our chairs, okay? Let's go ahead and have a seat. What I'd ask you, if you would move far enough away or turn your chair so that the tables are not an obstruction for your legs, because we will be lifting them up, and I want to make sure we're not kicking the table. Now, our leg strength is considered one of our life indicators. Remember, we talked about that yesterday. Your legs are everything. You must have leg strength to move, right? You even need leg strength to impact every other part of your body. We have an entire segment of exercise, right, that you cannot do unless you have strong legs. Cardiovascular exercise. If someone cannot stand for more than 30 seconds, how do they walk on a treadmill or walk outside? How do you impact your heart rate, right? So leg strength is so important to being able to stay balanced, avoid falls, and stay independent. How many of you woke up this morning? It's one of my favorites. So when you wake up, there are a couple of things you can do in bed, all right, before you get out of bed to help strengthen your legs and your body. The first ones are called hill slides. And all you simply do, pillow under your head, is you slide your heels, pull them as close to your bottom as you can, and then push them back out. If you've had any type of hip surgery or knee surgery, chances are you've done this with your physical therapist or your physio, all right, as they would say in the UK. And so here in class, I'm not going to make anyone get on the ground. You're welcome. But what we are going to do is we're going to perform heel slides from our chair. And so what I'll ask you to do is let's scoot out to about the middle of your chair, okay? I want you to sit up nice and tall, shoulders back. And all you're simply going to do is you can grab and hold on to the chair. You're going to slide your feet out in front of you, just like so. And then pull them right back so that your feet are flat on the ground. All right? And then we'll go for 2. We'll go out and in. And 3. Good. And 4. And 5. Good. 6. And 7. And 8. We'll do 12. 9. 10, keep that core tight. Pull that belly in. 11, last one. And 12. And relax. How many of you feel your legs working? Feel them burning a little bit? Yes. So what determined the amount of repetitions we just performed? This right here is the key to the fountain of youth. And what I mean by that is that our legs, right, keep us young. So what this number means is that 1 to 2 sets, right? So we just did a set of 12 repetitions. This program is catered to a variety of ability. Many people who have many different abilities. Some can stand all day. Some can't stand for more than 10 seconds. So what we did was we made a range. That's all this is. This is a range to be determined by you. So you may do this. The suggestion is to do it at least one set for 10 reps. We just did one set for 12 reps. All right? Or if you're really strong and you exercise, you walk often, you're active, you may want to choose to do 2 sets for 12 repetitions. You could also do 2 sets for 10. But the minimum is 1 set for 10 repetitions. The maximum is 2 sets for 12 repetitions. Any questions there? It gets confusing for people. Okay.
One question.
Yes, sir.
I notice for myself that I have a tendency to move my going back, so I'm not getting the benefit of holding up straight. Yeah.
So the benefit of doing the heel slides in the chair is you get a chance to work your core, because it's your abs, your abdominals, your lower back that's going to help keep you erect and avoid trying to create leverage, because that's what your body's trying to do. As your leg goes out, you're trying to create leverage so you can get them out. So now, what we're going to do is we're going to do this exercise we just performed, and now we're going to perform this exercise. Then we'll do that cycle all over again. Okay? So we're working in a circuit. Does that make sense? All right, here we go. So now we're going to do our leg extensions again. We're sitting about in the middle of our chair. Try not to allow your back to touch the back of the chair. Hold on. Core tight. Go ahead and sit up. And we're going to extend our legs out in front of us and down. Now, if that's really hard, scoot back in your chair a little bit. It makes it a little easier, right? And we'll go up, hold. I want you to squeeze your legs, contract those muscles, and down. Make a 90-degree angle. And 3, good. And 4, core tight. Pull your belly button in. 5 and 6, good. And 7, 8, 9, 10, well done. 11, good. 12, point those toes to the sky. 13, 2 more. 14, 15, rest. Now back to the edge of our chair. We're going to go back to our heel slides. If you feel yourself starting to fatigue or get really hard, this happens all the time in class, I want you to make it work for you. So don't feel like you have to follow us. If we do 8 reps and you're tired, stop. Don't forget it's early, so you still got the rest of your day. We want to leave some energy in the tank. Nice and tall, holding onto our chair. We're sliding our legs out and bringing them in. Okay, so we're going to slide our heels along the floor and bring them back in. Good. Try to sit up nice and tall if you can. Try not to allow your back to touch the back of the chair. That's it. Good. Good. In and out. That's it. Very good. Core tight. 5 more. 5, 4, 3, 2, and 1. Good, and relax. You wizened up. That's why we do it in bed, because typically folks are barefooted, and it's a lot easier. Your heel slides along the sheets a lot easier. I like doing these with our shoes on because of the friction the rubber makes with the carpet or a tile floor. It makes it harder. And if it's harder, it means our muscles are working more. So let's go ahead, let's scoot back into our chairs. Again, we're nice and tall, trying not to allow our back to touch the chair. We're holding on. We're going straight up. Squeeze those legs, make those muscles contract. And then right back down at a 90-degree angle. Good. That's it. And 3. We'll do 12 here. 4. Keep your core tight. 5. 6. 7, 8, good, point those toes to the sky, 9, 10, 11, last one, up and hold it, and rest. Good, catch your breath. We're going to take a second. Well done. All right. Any questions? This is our strength pillar. Yes, ma'am. Do you have a question?
Did you say there was another exercise we could do in bed?
No, ma'am. Just the hill slide so far.
Okay.
There is another one coming up.
Okay.
And so the thought behind that is if you one day do the hill slides, the next day you're going to do, oh yeah, good, I'll put that in there. Yeah, the hamstring low back stretch. So we'll get to that.
Okay. I
When we
just
come
thought I
to it.
heard you say that.
Yeah, yes, ma'am. So the idea is that you alternate. One morning do the hill slides, the next morning you can do another exercise.
Okay. Fine.
Get in the habit of doing something, though. If you do nothing, you get nothing. Does that make sense? Okay. So, good. And this is our strength pillar. These exercises are designed to strengthen the body. Now, a lot of these exercises cross over, but these here are specifically designed to keep our legs strong. That is the aim. Now we move into the posture pillar. These are not put in position arbitrarily. These pillars were placed in position for purpose, for a reason, right? And so we do strength first because it elevates the heart rate. Remember the exercise we talked about, the BDNF, the infrastructure, right? You feel your body temperature heating up a little bit. And in a real class, we would be moving pretty rapidly, you know. So I want to make sure we slow down just a little bit so everybody understands the grasp and the concept. So now what we're going to do is I'll have everyone stand. We're doing exercises in the posture pillar. We're going to stand, and let's put the chair on our left side. Since it's already there, we can put the chair on the left side. Now notice how our feet are side by side. In week 2, we advance and progress, and we move one foot in front of the other. In week 3, we close our eyes. Eventually, you get to the graduates program, you're doing this exercise on one foot, looking side to side. So you can see as we move through the weeks, we build on our progress. So let's start with our feet side by side. All right, hip width apart, knees slightly bent, nice and tall, shoulders back, core tight. Our hands are in front of us, pinkies touching. And what I want you to do is I want you to nice and slow push back, and I want you to push. I want you to stretch that chest out. Good. And then we're going to come back together, touch your pinkies. Good. And 2, push, 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 and together. That's it. Good. And 3, push, push, push. Good. And together. And 4, squeeze those shoulder blades. That's it. Good. And together. And 5, good, together. And 6, good, push. We're going to pick up the pace a little bit and together. And 7, push hard, good. And 8, I want you to feel that stretch in the chest and the shoulders, good. And 9, well done. And 10, good, keeping those palms to the sky. 11, one more time, 12, and relax. We're going to do this exercise again, but next time we're going to work in the split stance. So, next exercise, or exercise number 2, there's always 2 exercises per pillar, except in the balance pillar there are 4. So here, our chair reach and raise. So we're going to do this standing. That way we don't have to go back and forth. And what I want you to do, the ball just illustrates where our hands should be. I want you to imagine you're holding a little volleyball or basketball, if you will. My feet are a bit wider than hip width. My knees are slightly bent. And all I'm going to do, let me demonstrate and then you follow, is I'm just going to go down keeping my back flat. That is the hardest thing for people to do. Watch my back. Now, I want to keep my back flat. In other words, I should be able to have someone put a glass of water or bourbon on my back, right? Versus rounded. So what does that mean? That means I got to stick my bottom out. Okay? It's going to force me to engage what we call our core. So I've got my ball. I'm going to squeeze my shoulder blades together. And I'm going to go down about to my knees. Let your arms extend out in front of you. Hold. And then you're going to come right back up. Nice and tall. And then 2. Down. Now, if you can go past your knees safely, then go ahead and do so. And we're up. That's it. Good. And 3. And up. Good. Pull those shoulder blades together. And 4. You'll feel your weight shift to your heels. That's what you want. And up. Keeping your knees slightly bent. And 5. If you feel like you're getting lightheaded, just take a break. You can even sit down and up. Good. And 6. Good. Down, down, down. That's it. And up. And 7. And up. Last one. And 8. And up. And relax. Very good. Now with our chair still on our left side, I want to take my left foot forward and I'm going to get into my split stance. Your split stance will look different from everyone else's because we're all at different levels of balance. That's why. So if you feel really uncomfortable with your feet this far apart, then get them closer together so you have a stable base. All right? If you need to have them this close together, that is fine. But I want you to be 90% confident that you're not going to fall in this position, one foot in front of the other. So wherever that falls, wherever that percentage lies, you have to find it. Okay? Once you find it, we're going to be nice and tall. Get your bearings. Hands out in front of us. And we're going to open, stretch, let the chest out, and close. Very good. And 2. Good. Palms to the sky. And 3. Good. And 4. Good. One more time. And 5. And relax. Switch your feet. Now we'll put the right foot forward.
Should our weight have been on one leg or another?
Great question. Your weight should be split 50-50.
Yeah, I had mine too much on my back.
Yeah, okay. That's okay. We'll flip it around this time. Right foot
Okay.
forward this time.
I
Should be
felt the
even.
joint on my shoulder.
Yeah, yes, sir. Yeah, the stretching. As long as you weren't getting a lot of pain, you're okay. And if you are getting pain, then if pushing back this far hurts, then just go as far as you can. Okay. So now our right foot forward, same thing. Find your position, your balanced position of confidence. All right, keep your knees slightly bent, hands out in front of us. And let's begin. Nice and slow. You want to stay under control. And together. Good. And 2. Stretch that chest. Good. And 3. Good. And 4. Good. Weight split evenly on your feet. And 5. And 6. And relax. Well done. Catch your breath. Give us a couple of seconds here. All right. Now we'll go back to our chair reach and raise. Now, as we progress through the program, chair reach and raise turns into something like this in the graduates program, What that means is that you've been working on your balance for probably 15, 16 weeks now at this point. And so you'll start chair reach and raise. Well, we'll go down just like we're doing now, and we'll lift the ball up over our head. We'll shift, lift, down, and down. This time, let's go down and let's bring our hands above our head. All right? So let's hold our imaginary ball. Our feet are a little bit wider than hip width. That's it. Our knees are slightly bent. Our cores are tight. Remember, flat back as we go down. So we want to pinch our shoulder blades as we go down. Stick that bottom out. And let's begin. Going down as far as we feel comfortable. And then we're going to come up, up, up. You'll feel your weight shift to your heels. Hands over your head. That's it. Stay in control. Keep your nose over your toes. Don't let yourself drift back. And we're down and down. Good. And we're up and up and down. If you feel yourself getting lightheaded, just go ahead and stop and have a seat. Good. And up and up. Good. Keep that nose forward, nose over toes. That's it. Stay engaged. Good. Down and down. Two more. And up and up and down and down. Good. Last time. Up and up and down and down. Complete the rep. That's it. And relax. Good. Have a seat. Catch your breath. Well done. Made it look easy. Any questions? So this is the building block from which we build on. So not only is it a chance for your brain to kind of memorize where your body weight needs to be in all these different positions that we're going to use as we move forward, but it also gives you an opportunity to learn the verbiage too of your instructor. You know, how your instructor uses the language. So no questions there? Pretty straightforward. All right, now this is our flexibility pillar, right? And pillar is just a synonym for section. I'm just using it as a synonym for section. So this is my favorite because you get to sit down. Now, there are many, 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 many ways to strengthen a muscle. There's only a few ways to stretch them. And so what I mean by that, strengthen, is let's take our sit to stands. Did anyone practice that yesterday? Sitting slow where you get down and, avoid the plop. Mm-hmm. Try that today. Try to avoid the plop. Anytime you sit down, if you think about it, go slow, and you can use your hands and go down as slow as you can and try not to plop. Mm-hmm. The other thing, did anyone look at how people stand throughout the day? That's another interesting experiment that you can do without anyone knowing, is why are we better on one side than another? Well, watch how people stand in casual conversation. A lot of times, the majority of their weight is shifted to one side versus another. So remember, if I've done this for years, decades, I have 70%, 80% of my body weight on one side. It's not a stretch to give it the other 30 or 20, but to go the other way is quite a reach. So that's the explanation for why we're better on one side. Other explanations could be surgeries, pain. Maybe someone had a total joint replacement, a hip or a knee. That could be a reason too.
So you're saying that would be why I've noticed my balance is better on one side than the other. Is that,
I've asked physicians, I've asked therapists, I've asked every type of therapist. Friends, colleagues, professional colleagues, and I've given them my hypothesis, and they all have said, no one has tried to argue with me. No one has said, no, that's not it. They've all, well, that makes, Chris, that makes sense. That's right. Mm-hmm. So,
wow. Is it better to do all those with shorts rather than trousers?
Probably, yes, sir. But that just makes it harder, which is good for you because that means you're getting stronger. There's more resistance. Which quickly, osteoporosis, osteopenia is a big problem for women, especially as you get 65 and older. You know, you're starting to take these DEXA scans and you're getting these DEXA scan scores. What the doctor is going to tell you is you need to do resistance training or load-bearing exercises. This right here counts. I could have called this, instead of Balance University, I could have called this Osteoporosis University.
Really?
Because the benefits you get here are just as good as what you would get with this program, or just as good as what you would get going to a gym or a facility doing resistance training. This is the same thing, load-bearing exercise. I have a colleague in Naples that bought this machine. It was thousands and thousands and thousands of dollars. People would drive from all over to come in because this machine was specifically designed to reverse the effects of osteoporosis. I went to visit her because I wanted to see this machine, and I was blown away at the simplicity of it. I mean, I was expecting to see, I don't know what I was expecting to see. It wasn't that, I can tell you that. It wasn't what I saw. It was a simple machine where people would sit in a chair and they would have a foot plate that they would push against. Now, there was no movement. There was no eccentric or concentric contraction. It was all an isometric contraction, like holding a baby. You know, like the muscle didn't lengthen or didn't shorten. It was just holding steady. And you would hold it for 10 seconds. Then you would push. Then you would pull. Then you would press, push. You know, you would do all these different things. You'd use your body and push against. You would pull against. It would take 15 minutes, and people would drive hours. And I saw this, and I looked at her, and I said, "Are you kidding?" She goes, "I know, it's crazy." And I said, "Well, how long have you had it?" You know, she said, about 6 months. I said, "Have you made your return?" She goes, "Twice over." But that just goes to show the amount of information out there, the lack of you don't know what you don't know.
Right.
You know what I'm saying? Like if I walked onto a lacrosse field or Dr. Khan, my close friend and fellow who helped me, physician who helped me write the book, helped kind of guide me in different places and answer questions. He cricket. He's an Indian man, loves cricket. You know, so you don't know what you don't know, and so that's what we're here is try to educate. Now, flexibility, easy peasy. Second exercise you do in the morning. It doesn't matter, just do one. If you want to do both, fantastic. I strongly suggest and urge you to do the heel slides one day, the next day do this hamstring and low back stretch. Some of you will find when you wake up in the morning, if you were to slide your back all the way back against the headboard or the wall, you would have a very difficult time sitting straight up and down like this with your legs straight out in front of you. Because the hamstrings in the back of the legs are so tight from our daily living activities sitting. What you'll find is a couple of things. One, you're unable to get back this far, so maybe you're here. Two, you have to bend your knees. What we want to do is we want to undo this and make it possible so you can get your bottom all the way back and get your legs down. That tells me that our hamstrings are at their full length and operating in the range of motion they were designed to operate, right? Which means I should not have a disrupted or dysfunctional gait pattern because all these muscles back here now are able to operate and function throughout their entire range of motion. If I have a situation like that, what that means is that I can't extend my leg because my hamstrings are so tight. Think about a mooring line. A line from the pier to the boat. It's 10 feet long. What happens to that line if I tie 5 knots in it? Shortens, doesn't it? It's the same thing that's happening in the back of our legs when we sit. So how do we negate that? It's possible. We can. Simple. Take our right foot out in front of us. So you'll scoot out to the edge of your chair for this. Be careful not to scoot so far because we're going to reach down. I don't want the chair to tip on you. So you'll scoot to the edge. We're going to extend our left leg out in front of us. we're going to take our hands and we're just going to slide down as far as we can. Now, you'll start to feel a stretch in the back of your leg. You may feel it in the back of your knee. You may feel it in your calf. It's okay if your toe's pointing straight up. It's okay if it's pointing out. But what we're going to do is just hold that position. Is everyone feeling that pull in the back of their legs? And you're just going to hold that for about 20 seconds. Now, 20 is not an arbitrary number. That's the number our muscles need to get a good complete stretch. And 3, 2, 1, and relax. Now we're just going to do the same thing on the other side. So we'll take our right leg, extend it out. We'll take both hands, and we'll slide them down. That's it. And it may feel different on this side, and that's okay. Probably, chances are, it does. Good. And you're just holding. Good. And 5, 4, 3, 2, and 1. Good. And relax. You feel...
Slightly bent.
That's okay. And it's okay if your knee's slightly bent. As long as you're feeling a stretch or a pull in the back of your leg, on the posterior side of that leg, you're doing it right. It's really hard to mess up stretching. Now, I like to do a piriformis stretch. If you have hip replacements, a total joint replacement in the hip, don't do this. Just relax. If you have a joint replacement on the right side, you can do it on the left. What we're going to do is be crossing the midline here with our leg. And so what that means is if you have a joint replacement in the hip, if you have a hip replacement, that ball will pop out. My wife is a radiologist, a radiographer, and she has seen that many, many, many times. People forget, and then they go in. And the women usually come in not saying a word. The men come in, can't move. They're in a lot of pain, but she says most of the time women that happens to, they just, very stoic. It's the men not so much. So what I'll have you do is sit at the edge of the chair. We're going to sit up nice and tall. Let's start with the right leg, okay? And again, if you have a joint replacement in the hip, don't do this. We're going to just come over with our foot. Let's see if you can do that. Try to put your ankle on top of your knee. Aha! So now if you can't do that, straighten your leg out. And we're going to start with our foot down. All right? And then grab a towel or a band, and you're going to use that to your advantage.
Oh.
A towel or a band. Now this is if you can't get your foot up, right? If for some reason you can't, it's really tight. What you'll do is you'll grab that band and then you'll pull until you, as far as you can. And once you get there, you'll just lean forward. And you'll feel a really strong stretch back there in the glute, okay? So everybody, let's give it a shot. Best you can. We're going to cross over. We're putting the ankle, that bony ankle bone, putting it, and I just want you to lean forward if you can. Yeah. So relax. Try the other side now. Flip it around and try the other side. And it'll be different. It'll be different on one side. One side will be tighter than the other.
I'll have to buy some of these things.
Yeah, yes, sir. And relax. That's a stretch I do. All right. This is a little known muscle called the piriformis. Works in conjunction with the muscle called the psoas. It's the only muscle that connects the upper body to the lower body. Here's what happens is it connects in the lower part of the spine, right? And so when you have back pain or you have issues with your gait, chances are the psoas, the piriformis, are playing a role in that dysfunctional gait or that back pain. Because what happens is that psoas muscle connects to our spine, connects to our vertebrae, right? Runs down through the pelvic girdle and connects up underneath onto our femur. So as that muscle gets tight, it pulls everything down, right? It just winches down. This exercise is the only way you're going to stretch that muscle. And this is something we started doing in class because I noticed people were not doing certain exercises. Talk with them after class, back pain. And so we started doing this. I have one gentleman that used to play golf, and he was almost ready to quit because he was having so much pain. It was so hard for him to walk. He was having a lot of pain in his glutes. And we started doing that exercise, and I had to stay on him. He wasn't as good as he should have been. I had to stay on him. I saw him on a one-on-one basis twice a week. Sure enough, he plays golf 3 days a week still. Just from that simple little stretch. So, now the self-cervical stretch is for our necks. We talked about that yesterday. So we're going to sit in the back of our chair here. Again, we're going to try to keep our back off of the back of the chair. All right, we're going to take our left hand, and I want you to reach underneath the chair and hold the chair. Take your right hand, and you're going to go across your stomach. Nice and tall, chest up, chin up. Now, if this is the anchor, I want to lean and look away from the anchor, right? So if my left hand is holding, I'm going to lean and look to the right. I'm going to look up. I'm going to look down. I'm going to find the place where I feel the stretch the most. And I'm going to hold. And again, because I'm stretching, anytime I stretch, how much is the time? 20 seconds. Always holding a stretch for 20 seconds. And 5, 4, 3, 2, and 1. Let's flip and go the other way. Some of you may feel it in your arm, you may feel it in your shoulder, you may feel it in your neck, you may feel it all the way up to your ear. As long as you're feeling a stretch, you're doing it correctly. So now we'll take our right hand, we'll reach under the chair, take our left hand underneath the belly. We're going to lean and look to the left. Yep, right hand holding. Leaning and looking to the left. So you're leaning away from the hand that's holding. Look up. Look down. Find that place where you just feel that stretch big time and hold it. Good. And 5, 4, 3, 2, 1. And relax. Well done. The reason I like that stretch is because it increases my field of vision. When I walk, it gives me more freedom to be able to identify obstacles. Also, many times, most of us, we do not walk without talking. So we're conversing with someone, and you need to be able to look and have the freedom to converse without the pain so that you're focused on obstacles and walking and not on the pain or the lack of mobility in the neck. 2, driving. It increases your field of vision when we drive, which is essential for us to stay independent as we age. Does that make sense? Any questions? That is our flexibility pillar. It does not change very much. It does change a little bit, but we sit so much as a society, as Americans, especially in our Western culture, that we spend a lot of time trying to undo a lot of the things we do to ourselves throughout the day. So, all right. Let's move into the coup de grace here. We're going to go into our balance pillar. Now, there are 4 exercises for balance. And you understand the structure of why we've done it the way we've done. How many of you grew up in physical education, when you went out for physical education class in grade school, in elementary school, and the first thing the coach had you do was stretch? That's how I grew up. It's not how it's supposed to be. It wasn't until high school where we started doing some exercise first and then stretched. What we found was that muscle that is cold, right? Your body temperature is not warm, it's not heated. It's like steel. What happens to steel when it's cold and you try to stretch it or bend it? Breaks. Same thing with your muscles. So for a simple lap around a football field for football players or young kids is enough to heat their bodies up. Then they stretch. For us, This is why we do our strength pillar first and then our posture, then we stretch, because our body temperature has been raised and our muscles are a bit more pliable, more malleable. Does that make sense? You guys buy that? I just made it up. So let's do some balance. Let's get into the balance. So I'll have everyone stand, and we'll move in behind the chair, and we'll put the chair on our left side. You could probably work a situation out where you have a chair on each side of you. There you go. If I just turn it there, that chair can stay there. You have one on the right and the left. So that way you don't have to worry about moving or twisting. All right. This is one of the pillar exercises. Split stance standing, you will also hear me refer to it, or instructors refer to that as the balanced position of confidence. All right? And so it's something that we will build on. So what we'll do is with the chair on the left side, I want you to take your left foot forward. Just like we had done earlier.
The lower back chair.
Oh, yes, sir? Would you like
I'm just saying, does that matter?
Oh, no, sir. Not for this. Not for this. So, our left foot forward. All I want you to do is stand in this position and build some familiarity. Not going to do anything fancy. You're just going to stand here. I want the brain to get comfortable and recognize, kind of make a bookmark or a footnote. Whenever I say, okay, let's get into our balanced position of confidence or our split stance, you recall this position and you're able to get into it right away. Does that make sense? So just spend about 20 seconds here. Time's about up. We're about 90% confident we're not going to fall, right? That other 10% accounts for that proprioception. Good. Don't move. Let's add a variable. Let's close our eyes. Before you do, hand on your chair. Now close your eyes. Get your bearings. If you feel comfortable and confident, you can lift your hand, but keep it close. Make sure you're comfortable, confident. And 5, 4, 3, 2, and 1. Eyes open. How does that help us? If you feel a little unsteady there, from this 10%, by closing our eyes, 10% of proprioception, we just added another 20 to 30%, right? Because here I'm stable, but I'm maybe a little bit unstable. When I close my eyes, it becomes quite difficult to stay stable. I can do it, but what's happening? Think of all the signals traveling from our feet to our brain. Just like we're learning that French word, right? Or that salsa step. The more I'm in that position, the more those cells congregate in my brain, the easier I am to recall where I need to place my body weight. It begins to form that memory where the body understands what muscles it needs to contract to keep me erect and upright. Familiarity. That's all it is, really. Let's do the other side. So if you'd like, swing your chair around to the other side. That's another way to build the core if you're having to move your chair from back and forth. So we have our chair now on the right side. Oh, you have your chair there. You can use that one. Yes, sir. Yeah. Well, here you go. I'll give you this one. That way you have two of the same height. There you go. Yes, sir. Perfect. All right. So we've got our chair on the right side. Right foot forward. Same song and dance here. Same song and dance. Find your balanced position of confidence where you're about 90% confident in your positioning there, and just hold it. You're just going to hold it. Build some familiarity. We're going to give it a few seconds here. Good, good. Okay, hand on the chair. Let's add the variable. Go ahead and close your eyes. If you feel comfortable and confident, you feel safe, you can raise your hand an inch or so above the chair. Stay close to that chair, though. Five, 4, 3, 2, 1, and eyes open. How many of you notice a big difference between one side versus the other when you close your eyes? Yeah, isn't that something? So now, staying in this position right here with our right foot forward, we're going to move to the second exercise where we have our weight shifting. Now, in a normal position, I want to have my weight split 50-50. Half of my weight on the front, half on the back. When I start to shift my weight, I'm going to shift 70%, 80% to the front. Here's the important part. I'm going to shift that same 70-80% to the back. But what did I not do there? I have my weight on the front leg. Now I'm moving to the back leg. Big mistake people make is instead of keeping their nose forward, their nose goes backwards. Well, how many times have you seen people or you know of people that have fallen, they've fallen backwards? So what we want to do here is we want to practice keeping our weight forward. And as we shift our weight to our back leg, we keep our ears, our nose over our toes. We shift to the front, nose over toe. Shift to the back, nose over toes. Shift to the front, nose over toes. And so on. All right, let's give it a shot. So right foot forward. Remember, we're in our split stance or that balanced position of confidence. And we're going to shift our body weight to the front. Control. Shift that same body weight to the back. Knees slightly bent. Keep those knees bent. And to the front. And to the back. And to the front. And to the back. Now with your hand on the chair, close your eyes. And to the front, nice and slow. Stay safe. And to the back. Keep that nose forward. This is very important with your eyes closed. And to the front. And to the back. Keep that nose over your toes. And to the front. And to the back. Eyes open and relax. Good. Let's do the same thing on the other side. So we'll start here. Our left foot forward in our balanced position of confidence. Again, it may be different on this side versus the other. Same thing. We'll move 70-80% of our body weight to the front foot. And now we shift to the back foot. Keep it nose over toes. To the front. And to the back. Chest up, chin up. I want you to look straight ahead. To the front. And to the back. Well done. Front, hold, and back, hold. Good. Hand on the chair, close your eyes. To the front, hold, get your bearings, and to the back, nice and easy. Good. And to the front, and to the back. Keep that nose forward, don't let those shoulders drift back. To the front, and to the back. Well done. Eyes open, relax. Good. Any questions? Good, good. Your legs, you start to feel your legs. Are you working a little bit? Yeah. Good. So what we're doing here too is we're strengthening your legs, and as you go through the program, you'll see those legs get really strong. Staying in the same position. Remember in our posture pillar, we brought our arms to the side. In the balance pillar, we're going to take them over our head and try to touch our thumbs together without looking at them. Right? So it's an extra activity for the brain. Just like if we're walking and talking, we're going to break that gait pattern down, pause, and we're going to give the brain some extra activity to think about while we're trying to balance. Okay? So we've got our left foot forward. That's it. Our hands are out to the side, core tight, knees slightly bent. Our weight is split evenly, 50-50. And we're going to go up, touching the thumbs. If you can, that's okay. And down, nice and slow. And 2. And 3. Find something in front of you to focus on. Good. And 4. and 5, 6, 2 more, 7, and 8. Good. And relax. Switch it around. Let's do the other side. So this time our right foot will go forward. Again, same thing. In our balanced position of confidence, our knees are slightly bent. Our weight is split evenly, 50-50. Our hands are out to the side. My core is tight. I'm pulling my core in. And I'm going to go up, touch my thumbs, and down. And 2. And 3. And 4. And 5. And 6. And 7. One more. And 8. And rest.
I can't get my arms this straight. I can only bring them forward.
Right, that's okay. The goal is the more we do this, the more flexibility, the more strength that you'll build, and you'll see your range of motion increase. If it doesn't, we'll take a look and break it down and see what's going on. Last thing we're going to do, very simple. Chair on the right side. At the end of every class, I always have the class, the instructors, the instructors stand on one foot for 60 seconds. At the end of every class. This is how we start that process at getting better. You're just simply going to stand on your right foot. We're going to shift our weight. And all we're doing is we're bringing our left leg up and down. What I don't want to do is be out of control. So if I bring my leg up too high and I lose balance, that's too high. We'll start in a place where I'm most efficient. Right? I never want to be out of control. So let's do that. All right? We're going to be standing on our right leg. Our left leg is doing the moving. We're going to shift our weight to our right foot, hand on the chair. We're just simply going up as high as you can and down. And 2, you want to go slow. If you can move to 2 fingers on the chair. If you feel really comfortable and confident, you can raise your hand an inch or so. That's it. And 4, good. And 5, nice and slow. And 6, good. And 7, good. And 8. That's it. Well done. Let's flip it around to the other side for the finale. All right. Same thing. This time we have our weight. Our weight is going to be on our left foot. Our right leg is going to be doing the moving. Nice and tall. Find something in front of you and focus on it, a focal point. We're going to shift our weight to the left leg. Right leg is coming up and down. There's 1 and 2 and 3 and 4 and 5, 3 more, and 6, good, 7, last one, and 8. Well done. Have a seat. Great job. That is the class. And each week it gets harder and harder and harder, and we move faster and faster and faster. Because each week you're getting in better shape. Each week you're getting more familiar with the movements. And because everyone is doing their homework, at the end of class we give out handouts, usually in an email, so you get what we've done in class for that day. And so you can follow along and do those exercises throughout the week. I will tell you this, honestly, it doesn't take a whole lot, but it does take something. And the impetus to this class, watching what Mr. Wolf went through, was hard. And so that's how I became passionate about balance, and still am. You know, the more I've learned, I've been doing this balance specific since about 2015, and the book was published in 2018. So, any questions? No?
Well, you suggest that a person does this system daily?
Not this whole class.
Okay,
Not the whole thing.
all right.
What I would do is pick out, if you have time,
Mm-hmm. Oh,
the more what you get in, what you put in is what you get out.
all right.
But if you would take a strengthening exercise, and that's what we do in class when we send you the email of what we did that day, the curriculum, you get your handout in email. What we do is you have an asterisk or a highlighted exercise. There's usually two, and it's usually a strengthening exercise and a balance exercise. If you do those two exercises daily, that will play dividends, big dividends, in the overall results.
And then another day you would do two different ones, or what?
No, ma'am.
Okay.
Simple. Yeah,
Just
simple.
like one and one?
The next week I'll give you two new ones.
I see.
Next week I'll give you two new ones.
All right.
You certainly could do that. But what I have found is when you try to move all these parts, people get confused.
Yeah.
Simple is the best way. So at the end of each class, at the end of a week, I'll tell people, do these two this week. That's all I want you to do.
Mm-hmm.
Next week will be a different two.
Mm-hmm.
So that way you just focus on creating a habit, you know, creating a space or a time where you find in your day where you can do those two. And it doesn't take 5, 10, 15 minutes. It literally takes 2 minutes,
Hmm.
you know. So, all right. Well done. Thank you. You guys have been patient. I think we've been here a couple hours. Well done.
Thank you.
You're welcome.
Thank you.